An adult living in the UK today will have an average of 4 operations over the course of their life. Here at the University of Birmingham, we're investigating how to make surgeries safer, particularly looking at wound infections and how reducing them will be better for patients and it'll be better for the health service, freeing up bed days and saving millions of pounds. My name is Professor Thomas Pinkney. I'm a surgeon and an expert in surgical trial design. I'm the chief investigator of the Rossini platform study. This is an NIHR funded trial looking into surgical site infection, and we intend to recruit nearly 26,000 patients from 100 hospitals across the UK over the next 5 years. Surgical site infection is also called wound infection. It just means an infection of the wound where an operation is being performed, and it's surprisingly more common than people recognise. The rates are unacceptably high, I would say, across the UK and across the world. Different types of wound infection can affect patients in different ways. For example, after an amputation of a leg, it can stop a patient getting a prosthetic leg fitted, and it can sometimes involve more surgery and put a patient into a wheelchair, and so they can never walk, and it can be really quite impactful. We've been building towards this Rossini platform trial for some years, running surgical trials in the UK and beyond, and we've got great networks of surgeons and good expertise in these complex trial designs. The unique thing about the Rossini platform study is that it is a platform trial, so within one organisational structure we're running essentially 6 separate sub-trials where teams from around the country have picked what they want to look at to try and reduce wound infection, and they'll test those in their own contexts. At a time of unprecedented pressure on the health service, when there are millions of patients waiting for their operations to be done, it's really important that we work to understand infection and try and avoid this preventable complication. By running this trial well, we'll identify which interventions or groups of interventions work for which patients, and we'll be able to recommend across the NHS and beyond how these patients should be treated in the future.